Monural is a broad-spectrum antibacterial agent, a derivative of phosphonic acid intended for the treatment of urinary tract infections. Indications: infectious and inflammatory diseases caused by microorganisms sensitive to phosphomycin, acute bacterial cystitis, acute attacks of recurrent bacterial cystitis, bacterial nonspecific urethritis, asymptomatic massive bacteriuria in pregnant women, postoperative urinary tract infections, prevention of infections during surgical intervention on the urinary tract and during transreferral diagnostic studies. How to take, course of administration and dosage. Insight: the granules are dissolved in 1/2 cup of water, 50 to 75 milliliters, or as a drink, stirred until completely dissolved, taken immediately after dissolution. Monural is used once a day inside on the empty stomach, 1 hour before or 2 to 3 hours after a meal, preferably at bedtime, after emptying the bladder. Adults and children from 12 to 8 years old. 1 sachet, 3 grams, 1 time per day once, in order to prevent infection of the urinary tract during surgery. Transreferral diagnostic procedures. Monural is taken 2 times 3 grams, 3 hours before the intervention and 24 hours after the intervention. Children from 5 years to 12 years, 1 sachet, 2 grams, 1 time per day once, in order to prevent urinary tract infection during surgery. Transreferral diagnostic procedures. Monural is taken 2 times 2 grams, 3 hours before the intervention and 24 hours after the intervention. In more severe cases, elderly patients, recurrent infections, taking 1 more packet 24 hours later. In patients with mild or moderate renal insufficiency, dose adjustment is not required. In patients with severe renal insufficiency or those on hemodialysis, the use of the drug is contraindicated. In patients with hepatic insufficiency, dose adjustment is not required. Contraindications: hypersensitivity to phosphomycin, other components of the drug, severe renal failure, children under 12 years of age, for a dosage of 3 grams, children aged up to 5 years, for a dosage of 2 grams, hemodialysis, sucrase, isomaltase deficiency, fructose intolerance, glucose-galactose malabsorption. Use during pregnancy and lactation. During pregnancy, the drug is prescribed only when the potential benefit to the mother outweighs the potential risk to the fetus. If necessary, the appointment of the drug during lactation shall stop breastfeeding for the duration of treatment. Special instructions: life-threatening hypersensitivity reactions, including anaphylaxis and anaphylactic shock, may occur during treatment with phosphomycin. If such a reaction occurs, it is necessary to exclude repeated administration of phosphomycin and conduct adequate treatment. The drug is contraindicated in patients undergoing hemodialysis. If dizziness occurs, you should refrain from driving. Side effects: the most common adverse reactions that occurred in patients, regardless of the connection with the use of drugs, were diarrhea, headache, vaginitis, nausea, rhinitis, back pain, dysmenorrhea, pharyngitis, dizziness, abdominal pain, dyspepsia, asthenia, and rash.